afternoon, everybody. Again, my name is Alberto Reynoso Holston. I'm here also to advocate for the 340B discount programs, medication discount program. I myself am an HIV person, HIV positive person. I have also some opportunistic conditions caused for my health condition, and I already had been had been following the what happened with the Representative Scott Peter tried to do it to amend the 340B. Is going to affect very badly the access to medications. Some of us, we are in a very low income budget, and we are not in a situation to afford even co-payments that can be very high. I'm asking you also in behalf of the community, including AHF, that is my medical provider, to make any efforts to block any amend to the 340B. Thank you very much. That's all I have to say.
Thank you.
Thank you. And last, Eduardo Martinez.
Yes, good afternoon. My name is Eduardo Martinez, and I am with Eighth Healthcare Foundation. This is a nonprofit organization with close to 900,000 patients around the world. We're in 39 countries, basically in LA and Florida too. The reason we're here because on December 21st, Scott Peters, representative of San Diego, introduced a bill, HR 4710, with the intent to dismantle the 340B program. The 340B program provides discounts for nonprofit clinics and hospitals that work in the low-income communities. It's an agreement that's been in the system for 25 years. What it is the manufacturers give a discount on the medications for the hospitals, and then the insurance paid a full price for the medication, and in that manner, the hospitals and the clinics are able to save money in order to provide services and care for people that don't have insurance or are underinsured. I am a member of the HIV Commission of LA, and I'm not speaking representing them, just as a patient. We all are patients. If this is a bill that's going to be in Congress right now, it gets approved, it's going to drive a lot of people out of care, and we don't want that because the epidemic is not over yet. Another thing I wanted to mention, about 16 months ago, the taxpayers passed a law in order to help the homeless in LA. Measure HHH, and as far as we know right now, there hasn't any effect on the homeless people. We want to call on the mayor of Gas City to take action in order to help the homeless population in LA. Thank you.
Thank you. Before we move forward with our agenda items, we need to approve the minutes for our February 12, 2018 meeting.
So moved.
Any second? Okay. All agree, say aye.
Aye.
Any opposition? Any abstentions? Okay, we have one abstention. So the minutes are approved. Thank you. Okay, moving on to item number 1. We have a presentation and discussion of community violence prevention efforts by Anne Tremblay from the Gang Reduction and Youth Development Program, and also LAPD Commander Chris Pritchard. Thank you all for being here.
so that all commissioners can hear well and those listening across the World Wide Web.
Absolutely. Is that better?
Thank you.
You got it. President Vick and commissioners, I'm very pleased to be here on behalf of Mayor Eric Garcetti and the Mayor's Office of Gang Reduction and Youth Development to share a bit about what we do in the Mayor's Grid Office and how we partner across the city on gang prevention and intervention, and partner very closely with the Los Angeles Police Department in various ways to support the communities most in need of gang prevention and intervention services. So the Grid Office was established back in 2007 and has grown substantially. The city's increasingly invested in the Grid Office. We take a comprehensive approach based on public health model, and we have components of gang prevention, gang intervention, violence interruption, and community engagement. Prior to the meeting, I shared some information, an overview booklet that gives you a nice snapshot of all the components of the Mayor's Grid Office. We contract with 25 community-based organizations in 23 areas throughout the city, which we call grid zones. Those are areas of the city with highest levels of gang crime, gang violence, domestic violence, as well as areas that have high numbers of disconnected and out-of-school youth, high numbers of foster youth, and areas of the city that have experienced lack of economic opportunity and educational opportunities. So we try to focus, rather than many other programs in the city, the Grid Office is not divided by 15, it is not divided by council districts, but rather focuses on the areas with the highest need. So on the prevention side, those 25 community-based organizations either have prevention or intervention contracts. Some have both, depending on the area of the city. On the prevention side, the model that the agencies use to service youth and their families aged 10 to 15. And those youth are the youth that are determined at the highest risk of gang joining. We're very fortunate to have some wonderful partners in academia throughout the city, USC, UCLA, and Cal State LA. So on the prevention model, since there's so many community-based organizations that do a tremendous number of amazing programs, after-school programs, et cetera, we focus not on youth generally in prevention, not primary prevention, as it's called, but rather secondary prevention, so those youth at highest risk. And we do that through an assessment tool created by one of our academic partners at USC, a proprietary tool to work with those youth and their families. Our models are not just for the youth, but also for the family and parents. We hope to, within the youth and the family, increase protective factors that may be there, give that family tools that will help them to make sure that youth does not become gang involved, and then to reduce the risk factors that are found in the literature that can lead to gang joining. On the intervention side, our agencies who also work in those 23 zones work with 14 to 25-year-olds, so youth and young adults, as well as their family, however they define that, who are already gang affiliated or gang involved. Again, there's no eligibility tool, but there is an assessment tool that's used throughout services to determine, once again, if protective factors and pro-social factors are increasing and risk factors are reducing in the clients that are receiving services. Part of that intervention model also includes probably one of the most well-known pieces of the GRID model, which is violence interruption or street intervention. So you may have heard about community intervention workers, many of whom are former gang members, folks who are formerly gang involved, or those that have close ties and connections within gangs and can act with what we call a license to operate. They have the ability to interact and influence potentially those that might be gang involved. Citywide, we have about 120 intervention workers. give or take at any period of time. And along with our team in the grid office, they respond to all gang shootings and homicides that happen in the city. They are responsible for any responding to any gang shootings or homicides that occur in their assigned area. And we work together. We have a pretty set protocol and set of responses after shootings and gang shootings and homicides in an effort to prevent any retaliatory violence, to do rumor control, to make sure victims' families have connections to resources and victim assistance. And we do that in what we call a triangle. We have the Mayor's Grid Office, those intervention workers and agencies, and then LAPD, and we have a set communication and response protocol so that everybody is doing their part, everybody's staying in their lane, because the intervention workers aren't there to tell us who did the crime. It's not a whodunit, but rather to try to prevent that retaliation and to provide services. Those same intervention workers also are to do a tremendous amount of work proactively, negotiating truces if they're needed, trying to calm folks, even if it's if there's something that's kicked up within a gang, that's because sometimes there's intra-gang violence, doing whatever they can to prevent that next shooting and homicide, and doing that with good communication. We convene meetings on a regular basis at each LAPD division with our prevention and intervention partners, our grid team member, and LAPD staff officers, so that there's regular information sharing and that everybody's on the same page about what each are going to do in response to any trends or issues that are coming up around gangs in that particular area. As a part of that, our intervention workers receive a certification training, 140 hours, and then every 3 years they get recertified. So we've worked very hard in this city to professionalize that work, to make sure that there's a solid minimum pay, life insurance, and health insurance for those folks. So we're really ahead of the nation in how we've professionalized and supported the capacity of those community members that may have once been gang involved but are now actively trying to support their community and prevent future violence. The last component of our comprehensive strategy is community engagement. The best known piece of that is the Summer Nightlights program. That program we do in conjunction with the city's Recreation and Parks Department, as well as LAPD, as well as all our community-based agencies and other members of the city family, to keep 32 parks in high gang crime areas open in the summer months. From 7 p.m. to 11 p.m., free food, free sports, free arts, a tremendous amount of opportunities around issues of public health, HIV testing, vision testing. We have the fire department out, the police department, just everybody we can think of to fill that community with resources and activities to keep folks busy and engaged. That program covers the whole life cycle. It's not just for youth and young adults. It goes from very young children all the way through to seniors. Many people feed their families during the summer with the free food that's served, and it is a significant component in the city's youth summer hiring. It's the best paid and most number of hours of any of the youth hiring jobs within the city and within Hire LA. And we hire youth from the communities around that park, and that's over 400 youth every summer hired to actually create the programming, lead the programming, cook the food, and engage in their community and lead their community. We also have a pilot on the community engagement side that we've been doing for the last couple of years, not at all 32 parks, but doing some Friday night programming at parks and areas that have experienced maybe upticks in violence or need some particular attention. That's our Fall Friday Nights program. We also work very closely with LAPD on the city's annual gun buyback. So that will be May 12th this year. at 2 locations, one near Dodger Stadium and one in the Valley. And that continues a multi-year tradition of having at least one gun buyback in the city in an effort to remove guns that are often, based on our surveys at those gun buybacks, not secured in the home, unused, unwanted. And so we want to get those removed. Sometimes it's an anonymous gun buyback, so we don't know whether those guns, they're not tested or anything like that, whether they are crime guns. But the city's perspective is, and the research shows, that the most important thing is to get a gun that's not secured, not utilized, or could be subject, especially if it's not secured, to being stolen in a burglary and then becoming a crime gun, out of the house and taken off to be destroyed. The statistics tell us, right, that the availability of a gun makes suicide very easy, so we're also talking about the suicide prevention. So any form of gun violence, we're hoping that gun buyback can impact. And for the last several years, each one of those gun buybacks has resulted in 700 to 800 firearms, everything from handguns to automatic weapons being turned in and cataloged and destroyed. In addition, on the community engagement front, if there's issues or concerns that come up in particular communities, we will activate to create community-based events, look for opportunities to provide a way for a community police trust building, working with LAPD on that front, since we have a private foundation, the GRID Foundation, that works with us on our community-based. We have private funding for some activities, including summer night lights, and we're able to create events that can allow for that engagement, education, and outreach. So that's the big overview, and I'm happy to answer any questions.
Commissioner Surich, did you have a...
Okay, thank you. The folks that are employed through the program, do they get any opportunity to apply for employment with the city? I mean, they may have had, a gang-related upbringing, but, I mean, they potentially could become police officers or firefighters or otherwise employed by the city.
Certainly, we work, our providers work closely with the Youth Source, Family Source, and Work Source to look for workforce development opportunities for clients, prevention and intervention clients. Certainly, the younger ones for the youth employment, many of them have become members of the youth squad or working at summer night lights. But I'd say the summer night lights teams are the more, and employees are the ones that have converted into city employees versus clients. I'm just being straight up. That hasn't happened too often. I think there's a lot of barriers there before they're ready for that employment. But certainly one of the things we did a couple years ago was with the youth squad and all the jobs for summer night lights, they are now city employees. They're seasonal city employees through Rec and Parks. That only happened 3 years ago. We created a new class of jobs, and many of those youth and folks do have backgrounds. They may not have been GRID clients, but they may have gang affiliation or some sort of criminal justice involvement as a youth or young adult, and they have been hired. And in the GRID office, we have multiple employees that were originally hired and working summer night lights who've now become mayor office employees. And that's true throughout the mayor's office. And Recreation and Parks will often hire those folks as well.
I have one more question. Does this issue of the gang injunctions affect anything that you do, the presence or absence of those as they've been?
No, it sure doesn't, because the work that we do and how our agencies and intervention workers or case managers navigate that. That's an enforcement piece, and that's on LAPD and the city attorney's piece. We don't take a position or interact on that anyway, except with the most recent gang injunction, the settlement in the Rodriguez case, where 26 of those injunctions were subject to that lawsuit. And we've been working with the Economic and Workforce Development Department of the city because they are managing that settlement and the resources made available in that settlement. So we've been working with them. We set up a series of meetings with our intervention agencies regionally, so they're educated on that, and the case managers can make sure that if clients are eligible or they want to assign the benefits to their children, that they're accessing the benefits of that settlement. So that's the only role we're playing in that.
Thank you.
Commissioner Canto?
I have a couple of questions. Thank you for your presentation. First of all, do any of the universities, are they keeping track of data to see if there is like a reduction of gang?
Yes. Well, I've got a lot of data for you. If you want it, yes, we invest very deeply in data research and evaluation. We have a data infrastructure that's grown over time, so we both have process and outcome data. And I brought a summary of that I can share with you. We have seen broadly in the grid zones, we have seen gang crime and gang violent crime reduction within in the grid zones. In 2017, that came at a little higher rate than the rest of the city. But that's hard. That's a tough one. Crime's gone down everywhere, including in the city. So saying it was attributable to grid, can't say for sure, but we report that out. What we do have is independent evaluation that shows, for example, for the first time we were able to do an evaluation on the street intervention, on the violence interruption component. So for the period of 2015 to 2016, one of our evaluation partners, a professor at UCLA, Dr. Jeff Brantingham, who also happens to work with LAPD on their predictive policing approach, did an evaluation for us with looking at LAPD data as well as our grid response data to shootings and homicides. And he predicts, based on his analytical models, that 185 shootings and homicides were prevented in 2015 and 2016 as a result of our model here, of our response by the grid team and the intervention workers. And that's the estimated cost savings of that was $110 million over a 2-year period. He's just started analyzing last year, 2017, and the trend appears to continue, that that piece of the work is working. On the prevention side, that's the longest piece of the model that GRID is implemented with a set model, with set dosage. And we did see significant reductions in the risk factors of the youth who were served. And again, I'm happy to share those reports and summaries of those reports with you. On the intervention side for that model, we have a much smaller data set, but there was still a statistically significant reduction in risk factors for those clients as well. So we have certainly some evidence getting to the point of evidence-based practice on the prevention side and some promising practice on the intervention side to establish the efficacy of this work. And we invest over $1 million of the GRID budget in data research and evaluation and training and more training and capacity building for the community-based organizations doing the work so that we can constantly improve and make sure that we're serving the folks that need to be served and we're serving them well.
And how do you screen the nonprofits that are your prevention and intervention providers, and do you have like a contract with them that goes for so many years?
Yes, we have a procurement. We're currently in the process of a procurement. We do that for those who are successful and selected as a part of that procurement will be eligible to contract with us for 3 years. Obviously, as a city, we can't do a 3-year contract, so it's renewable. They get the contract for the first year, and it's renewable for an additional 2 years. So as of July 1st, we potentially could have quite a different set of contractors depending on how that goes. So it's in the works right now.
One last question, sorry. And in the areas where you have the 32 parks where you're doing the summer night lights, to what extent are you working with the neighborhood councils in those areas, outreaching to them to be a part of this, or not?
In many cases, I think it depends on the area and how engaged the neighborhood council has been, but we share everything we do with Summer Night Lights and invite all stakeholders, including neighborhood councils, to be engaged and involved. The programming at each park we try to keep it even throughout the city, but every area is unique and there's different interest levels for different type of programming. So we create a working group of stakeholders, both for the hiring process for the youth, but also every week throughout the summer to plan the programming. And city council offices, neighborhood councils, the community police advisory board members that may be working with a particular LAPD division, whoever wants to be a part of that working group can, so that they can engage. And if they want to create some programming at that park, we welcome that partnership as well.
Okay, thank you.
Yes, Commissioner Shannon.
I have a few questions. Thank you so much for the work that you're doing. And this is, I'm hopeful that the reduction in violence in the grid is because of the work that you're doing. I have just a few questions. One is, in terms of employment opportunities, my mother worked actually with black gangs in Chicago. And one of the things that part of her program was to move people who were involved in gangs into organizing jobs, which seemed like a lateral move in a lot of ways. So I'm wondering if you've explored that. Because I work with homeless and low-income communities. I know a lot of these job programs tend to be sort of dead-end jobs for a lot of folks. And so I'm just wondering, is that sort of what you're looking at, or are you looking for something more long-term and lucrative and a future?
Well, I think it really varies, because for example, for intervention, it's a case management model, so it's really going to depend in part on what that person's experience and interest level is. Some of them, because we're talking 14 to 25-year-olds are our model clients, they may still, want to finish school or go into a trade school. I will say the organizing piece does come up, so that the course I told you about, the 140-hour course, certification course, those intervention workers get credits towards a community organizing certificate through LA Trade Tech. So we do see the connection with that work. A lot of the folks that may have been clients or engaged they're very committed to working in these nonprofits. They're either intervention workers or case managers. But we want the folks who are clients to have all the opportunities of anyone else. And it's why we're trying to bridge the gap between, say, the Economic and Workforce Development Department and make sure that their staff know how to service these clients, because they may not be what they've always seen before, and getting them through the door. Because I think there's a whole range of opportunities. The labor unions, obviously, with the different training programs, those have a lot of appeal. We don't have a workforce piece of the grid model. It's more refer and connect, but it's something that's coming up all the time. On the true reentry kind of front, we only do that on the juvenile level. We have a juvenile reentry project with probation, so that's much more about getting them back into school and the right school for them versus the workforce development piece.
Okay. And then if you could explain what the role of the LAPD is in this program, and I'm wondering if sort of, because we hear constantly about the shooting of unarmed black and brown residents in Los Angeles. I'm wondering if you've seen that as somewhat of a barrier, or as in terms of a trust issue, working with the LAPD on intervention, but then also on the other end, hearing about people who are unarmed or being shot.
Well, those are tough issues, and obviously they come up in our work. Many times the shootings, officer-involved shootings, happen in the communities that our contractors are working and that our team in the mayor's office is working. I would say that based on my experience, I've been with GRID for just over 4 years. I've been with the city for 16 years. I'm formerly a prosecutor. And have a lot of experience, particularly in South LA, being embedded in an LAPD division and sort of watching some of the change that's happened over time in the city. And from where I sit, and I think from many of our partners sit, I actually believe the fact that the city invests in intervention and that we've been able to build these partnerships and sort of while folks each staying in their own lane and knowing their own lane, the police and their enforcement and their role, our intervention in theirs, that because we've worked so hard as a city at that, and it wasn't always easy, that those relationships and trust that have been built between, say, intervention workers and our intervention agencies and LAPD, sometimes on their own, oftentimes sort of brokered and bridged by the GRID office, I think has put our city in a stronger state for when there are officer-involved shootings. Our team, our intervention workers, our team often will respond in some way to the officer-involved shootings. I will say, sadly, it's happened more than once that a deceased person in an officer-involved shooting has been a GRID client. So our intervention agencies, the team in the mayor's office, have been deeply engaged in some of those. And I think, based on everything I've heard back from community members and from the LAPD, we've been able to play a constructive role in keeping a productive dialogue going in the aftermath of such a tragic event. Armed, unarmed, whatever, it almost, those particulars don't matter so much as keeping folks being able to step back, listen, make sure that we're doing rumor control if it needs to be done, but that we're talking and moving forward even in the wake of a tragedy. And I really feel like that's one of the unique things we have here in LA because of that. And I think, for longer term, LAPD post the consent decree has made great strides in building community relationships. And I don't think I say that because I'm a cheerleader for them. That's just, from where I sit, that's happened. And I think programs like Summer Night Lights gives a built-in opportunity for LAPD officers to engage with community members when things are going well, when it's positive, when it's sports, when it's all those things, so that when the very difficult moments, whether it's a regular shooting of some sort or an officer-involved shooting, that each know their role, they respect each other, and they trust each other to some level enough that we can get through that difficult situation without tragedy being piled on top of tragedy. I feel pretty strongly about it. I don't have a report on that, but from where I sit, I feel pretty strongly that has been key in our city and that doesn't exist in other cities.
Okay, thank you.
Thank you for a wonderful presentation. I was wondering if we could get those reports, if you could have them sent to the city clerk and then send them to us. We'd appreciate that.
Sure, and I've got two things. I got a summary, if that's easier for you, or if you want the full reports, there's a lot of them. But whatever you want.
You can send us the executive summary, and we can
Okay.
always request the
Yeah.
whole report afterwards. But,
Sure. Happy to do that.
The other thing is, what's your annual budget, and if you could break down the budget for the different divisions of your program?
Okay, so it gets a little bit tricky, but I'll try to keep it simple as possible. So for GRID, so for gang prevention, intervention, and violence interruption, For the grid office, the annual budget in the general fund is $26 million. We also have an additional 2 million or plus that come from state and federal grants. And then summer night lights is sort of a separate line item. And the summer nightlight budget is a combined budget of about 6.6 million. About 4 of that is from the general fund, which now goes to Rec and Parks for the employment piece, as well as some of their internal staffing needs that they had to add on for the program. And then the other $2.6 million is raised through corporate donations and philanthropic donations.
Does the other divisions get any philanthropic or corporate partnership?
The gang prevention, intervention, and violence interruption is all general or grant-funded money.
Okay. And the other thing is you mentioned that we're doing something that other cities aren't doing. Do you have data that shows success where the other cities unfortunately don't have that in regards to reduction of gang violence? And if so, is there a way to take your model and send it across the country?
I'm not aware. I mean, certainly no place in the country that I'm aware of does in the comprehensive way the city does. Prevention, intervention, violence interruption, and this community engagement piece. Many cities, Chicago, D.C., Oakland, have street intervention and violence interruption services, but they aren't part of a comprehensive strategy. And no place I'm aware of has a mayor's grid office with program coordinators that are bridging a relationship with LAPD or with law enforcement, that are working to do training and technical assistance and constantly support the capacity of the nonprofit community-based organizations. And I spend easily 10 to 15 hours a month at a minimum sharing what we do with other cities and other countries. I am not joking, this sounds funny, but 2 weeks ago, a delegation from Uzbekistan was here wanting to learn about what we do for youth violence reduction. I was in DC a couple weeks ago speaking before a group from the National Attorneys General's Association to talk about this approach. So we spend a lot of time sharing what we've done and how we've done it. And I think nobody in the country has that data we have on the violence interruption, on the street intervention piece, showing, like, this city, I think anecdotally, you'd hear from LAPD, you'd certainly hear from intervention in the community, that street intervention has helped reduce gang crime. But until we had that report, that evaluation report, we never had that hard data. We had crime reduction, but again, without the right kind of analytics, crime reduction can happen for a lot of reasons. I mean, that's a national debate right now. Why has crime at historic lows in much of the country? And you've got a lot of theories about that. But for gang violence in the city, a reduction of shootings and homicides, which is our focus, we've got that now. And so it's unprecedented. And to my knowledge, nobody in the country has that. Yes.
A couple of questions. Do the senior lead officers get involved with this quite a bit? I'm just wondering because they're there in the community.
Summer night lights, they certainly do.
Okay.
For the intervention and those partnership meetings we do, that tends to be leadership at the division, so captains, lieutenants, and the gang units, because they're the ones who are connecting around that work, or gang detectives, because they might be investigating the shootings or homicides.
And do you work, some of these areas, as I look at this, of course, are adjacent to other jurisdictions, Sheriff's Department, Glendale PD or something. Is there some interaction with those agencies because the potential victims and so on don't recognize the lines necessarily?
Yes.
I just wondered if there's coordination.
Sure, there is to some degree. I mean, again, the county doesn't have a grid office. They don't.
I'm sorry, they do or they
They
don't?
do not. They don't have an equivalent, and they don't. They have at various times, but it's only now that they're starting through their Department of Public Health to fund street intervention. Again, that's happened at different times, but they haven't. To my understanding, it hasn't been sustained. So what we did a couple years ago, for example, I'll give you an example. We do coordinate not so much with the county, but we do work in the county to make sure, just like LAPD does, to make sure that violence doesn't spill over. And so South LA, the Vermont Corridor, and Watts are a good example.
City Terrace, I imagine.
Yeah. And we fund in South LA, because there was about 2.5 years ago, there was a big uptick and sort of a social media craze that had people in great fear that was sort of potentially coming from the county side. We we fund on a stipend base some intervention workers with gangs that are completely in the county but have rivals in the city to try to do that. And then the last thing I'll say really quickly is we did partner with the County Department of Public Health and their Parks Department, and we provided through contract a intervention service at 2 of their parks that have the Parks After Dark program that are right on the city border. And that was very effective, and that got them, and I think some of the sheriff's deputies, a little more comfortable with this idea of intervention workers. So I would say particularly with the Department of Public Health Violence Prevention Initiative in the county, we've stayed in close touch with them to try to share best practices and bridge that gap, and we're hopeful that maybe we'll do that at Parks After Dark again this summer. And they fund that. I mean, obviously we can't do that. It's in the county, but if they fund us, we've done that, and council has approved that.
Perfect.
Thank you.
Commissioner Sharp?
Thank you, President Vick. Good evening. Thank you for your time this evening. Appreciate your presentation. My children attend school in one of the zones, so I guess we're appreciative of your efforts on our safety as a household. Thank you for that. I also serve on the HCLA Commission that oversees the Family Source Center system. And at every one of those hearings over the last year, there's been a long discussion about improving coordination with LAUSD. And that has primarily been about data collection and very complicated things that I can't really track or recall at this point. But the thread that's interested me the most is the extent to which the schools are equipping students with stronger skills to manage conflict and be able to navigate the inevitable challenges of being a teenager and a neighborhood with access to too much weapons, too much drugs, too much trouble. What's your perspective on whether LAUSD is really making progress in this area? The Family Source Center system is looking at the new mental health funding streams and other ways to strengthen the capacity of the school district to identify and support the type of intervention that occurs at Family Source Center and or with you guys. What's happening in the schools, though, to basically, to better support the students to address the conflicts and to prevent this type of violence from occurring?
Well, I can't speak specifically to what LAUSD is doing, but I can talk to you about how our contracted agencies work with LAUSD. So we have, which is, since you may be aware, based on your experience, we have the rare privilege of having a district-wide MOU with LAUSD, which is not easy to get, but we persevered and got it so that our agencies, our grid contractors, can have access in the school, since many of the principals won't let folks in if they don't feel like it's sanctioned, etc. So having that MOU has been a big boon. Still, the principals have a lot of control over their school, and some don't want to engage with our prevention and intervention contractors, but many of them do because they see it as a value add, whether it's doing parent education by our prevention agencies, on looking at risk factors for their youth, their children, and whether they might become gang involved, or it's connecting them to services. Many of the schools will let those intervention workers be present on the school, do sessions at the school, and engage those youth so that they can get referred to services. We're also fortunate that many of our grid contractors, some of their names you'll recognize because they are also Family Source or Youth Source or Work Source contractors. There is crossover. We use the schools we try to be a value add to them, but also it's a great source of connecting with clients and families for our agencies.
Let me see if I can restate it. You've now prompted me to think of it more clearly. LUSD moved to a restorative justice model in order to reduce the number of suspensions. That's what I was thinking. Has that created a new opportunity?
I honestly don't know whether it has or it hasn't. That would come from our providers who are on the ground working in different schools.
I had a question. How many children or how many families are sort of touched or have you touched maybe in a year's time that go through the program? Kind of want to get a grasp of the scope.
Sure. So in 2017, on the prevention side, 3,966 clients were served, but the number of folks served is actually greater than that because that's just the clients, and our model is to serve the client, the youth, and their family. On the intervention side, that was last year was 2,890, and both of those numbers were up from 2016. So engaging and keeping clients, it's all voluntary, it's not court ordered, it's not probation ordered. All of these services are voluntary. So our agencies work very hard to convert those referrals to clients by engaging them, gaining their trust, and offering a full range of services.
Perfect. Any more questions? And I didn't know if Commander Pritchard did you have a presentation?
I certainly do. If you have the time, I wanted to kind of cover a little bit of what Ms. Tremblay was talking about, but I'll cover it and outline for you some programs and some efforts that the department is engaging in around GRID and on a continual basis. So what we've done is we look at the key there, just like GRID, is prevention. We like to obviously get out in front of crime first to prevent it, and ultimately, when that doesn't work, we enter into suppression. However, what you've read through the papers and the redeployment of officers, in the areas is, as the assistant to the director of operations, I'm responsible for about 5,600 officers and detectives citywide. So that is the largest part of the department, and those are the officers that we deploy in the basic cars that answer your radio calls for service, the detectives that investigate those crimes, and ultimately the gang officers that are employed out there on a daily basis to address the gang issues before they happen. So just to give you a little bit of understanding is what we did with the department coming into this is we ended up turning the department upside down, if you will, shaking out the building, putting all the administrative officers out to work. So we put back about 350 officers back into the 21 geographic areas, or what you would know as stations within your communities, to work on a daily basis. And those efforts are not just suppression, but prevention of the crimes with the gangs, with the individuals out there, and then to engage in the community engagement efforts with the community. As she was saying, this is a critical time for the department, and ultimately we know that. And we're making every effort to engage and to stretch our relationships with the community members. Because as she says, when we have these shooting incidents, when we have these critical incidents, that's the time where we develop these relationships, the trust, the honesty, the respect, the integrity. So that's the department's focal point. In addition to that, we have a metropolitan division, which is about 400 officers that they deploy throughout the city of Los Angeles to all of the hot spots. We put them out there before the crimes occur in order to prevent the crimes. We look at intelligence, information that we gain through different sources, through community members, through officers on the streets, and we deploy these individuals out there to stop the crimes before they happen. But when we can't, ultimately they're there for suppression efforts to basically be there to protect the community members and keep the violence from escalating. We are also in charge of the 21 GED or gang enforcement details that are assigned to each of the stations. They basically have about 10 officers assigned to them with a detective. They basically are the experts in each of the neighborhoods, whether you're in East LA or South Los Angeles or in the Valley. They know those gangs. They work with the gangs. They have all of the intelligence and the focus on those gangs. And they work with the grid offices, not only just suppression, but ultimately to discuss all of the issues that are going on with the gangs so that we can hopefully rectify some of these. We have put in what we call a CSOC, or a Community Safety Operations Center. And this operates in the central part of Los Angeles as well as the south portion part of Los Angeles. It is a command post that is run on a daily basis that operates from data and intelligence that's geared towards preventing the violent crime that we hear about, and most of that involves the gangs. And so ultimately we're involved with GRID, we're involved with the programs, we're involved with the patrol officers, the detectives on a daily basis to address these issues before they reach that level where they're going to explode into shootings. And I'll give you some statistics at the end of this presentation that I think that's going to make you very happy and show you that this is a very successful effort and partnership, not only with the department but with GRID and the programs that they run. We are preparing for what we call the Summer of Violent Crime Prevention details in all of our geographic areas. At the end of this month, each of the areas will turn in from their commanding officers plans that will outline and detail the deployments that they're going to have throughout the summer, where they're going to deploy their officers, the issues they're going to have, what they feel are going to be their critical issues and trends, and they will address those crimes, many of which include the gang issues, many of which they will try to get out in front of ultimately when they see the gang issues popping up in each of their 21 community areas. Each one of these CSOC, or the Community Safety Operations Center, we maintain an investigative response team to roll out into the communities very quickly to address the issues, to find out who did the crime, and ultimately to suppress those efforts from growing. We have daily crime conference calls and intelligence calls that we talk to all of the issues. And to get back to your point over here, sir, is we talk to the contiguous areas, the LA County Sheriffs. We talk to San Fernando PD. We talk to Burbank, Glendale, a whole host of these agencies that surround the city of Los Angeles to gather intelligence on a daily basis, to find out what the gangs are doing, to find out what the issues are doing and demonstrations that we have going on that may impact the community and the various communities in the city of Los Angeles. We have what's known as a CDO, or a chief duty officer, where we will put a command officer out at night to drive around the city in these areas to ultimately provide immediate command presence in an area that they can resolve problems quickly and move resources when they have to, when they see that an issue is developing in a certain community, that they can put all of the resources that they have at the department's disposal so that we can take care of that issue once again before it blows up. They deploy the metropolitan resources daily wherever we go, whether it's Valley Bureau or Central or South or West bureaus. It doesn't matter. We have about 80 individual officers in each one of those bureaus that responds to crime on a daily basis, and not just crime for suppression, but for prevention efforts. They're out there driving around, making community engagements, talking with individuals, and ultimately, hopefully, preventing the crime before it happens. We are involved in the Community Safety Partnership, which is a CSP. It's a program that is focused on establishing a partnership between the police and the communities that it serves. And it operates right now in 4 divisions across 2 bureaus, one in the south portion of Los Angeles and the other in the central part of the city of LA. And ultimately, the officers, there are 7 supervisors and 70 officers that don't take suppression efforts. They aren't out there for enforcement. They are out there to make community engagement efforts with that, all of the members of the community, to talk to the youth, give them opportunities. We have individuals coaching football programs, the Watts Bears that you've read about, that have been recognized nationally and taken to the last year's Super Bowl. That is an LAPD-sponsored function, and the coaches are LAPD officers. The department sponsors Girl Scouts, Boy Scouts, different entities that are out in these communities. They work with them. The officers are out there on a daily basis working with those community members to ensure that they open up those avenues and those relationships. And that's what we're all about. That CSP program, the Community Safety Partnership, is not about enforcement. It is about building relationships with that community, building trust, building the honesty and the integrity. We also are running a Los Angeles Gun Crime Intelligence Center from a grant from the Bureau of Justice Administration. Our partners in that are the Los Angeles City Attorney's Office, the District Attorney's Office, the ATF, and our own officers in this one division in 77th in the south part of Los Angeles. We're out there. We gather all of the expended case cartridges. We send an investigative team out there to grab all of the cartridges. We take them back to the National Institute, the ballistics, what we call the NIBIN laboratories. They are entered into that system, and they are linked with gun crimes in this community, outside throughout the state, all over the United States. And it gives us the opportunity to make more effective prosecutions and ultimately to address the gun crimes as it plagues our communities. In this one CSP area, we had a reduction of 34 less shots fired incidents this year alone, and 10 less individuals who were hit by gunfire during the first 3 months and 9 days of this calendar year. That's how effective this program is when it runs in just one area in the city of Los Angeles. And then we move on to the Summer Night Lights program. We have the deployment of uniformed officers at the 32 parks that Ms. Tremblay had talked about. In fact, we basically kid the officers. We pay them to make sure that nothing goes wrong, but we also pay them to hang out with everybody at the park. They shoot hoops. They throw footballs with the individuals there. They talk with the kids, young and old. They talk with the parents. They're out there from 7 to about 11 p.m. They're going to start in June and go through August or until the funds run out. It is an outstanding program. We highly support it. We like it. The officers love working that program with GRID, and ultimately that is a partnership, a very successful one that we have shared the last several years, and we'd love to continue that, and we're looking forward to that. We have a Juvenile Justice Crime Prevention Act right now. It's a grant-funded act from the county probation that ultimately provides for safe passages, the program in and around the schools. Right now, we have identified 58 sites that the officers are paid. We have 4 officers assigned to these 58 sites, and they work 4 hours a day to make sure that the kids get to and from schools. They don't have any issues with crime or bullying. It's not enforcement, but once again, to build the relationship with the youth and prevent the crime, with the youth being victims primarily. And then last but not least, I wanted to leave you with these statistics that would back up the success of not only the department's efforts in conjunction with what we do, but also with what GRID does. And they play a large part in what we do because they're involved in those gang enforcement efforts, of which we have a lot of issues in the city. But right now, we've had a reduction in citywide shooting victims by 86 fewer victims thus far this year. In the first 3 months and 9 days through April 9th, we have had 86 fewer victims who were hit by gunfire in the city of Los Angeles. Primarily, those individuals are and typically turn out to be gang members, not only as the perpetrators of the violence, but also the victims of the violence too. We have had a reduction in citywide homicides by 11 less victims of a homicide this year in the first 3 months and 9 days, which is outstanding. And we attribute that to the efforts of not only our officers, but ultimately the partnership with GRID that we share once again, with them. And we work very loosely with the interventionists. We don't work with them because they work behind the scenes, and ultimately we don't, lay them out. We don't talk to them. They work for GRID, but they provide a valuable service to the department and to the city and community members with the work that they do behind the scenes and working with the gang members in their discussions with them. And last but not least, we have a year-to-date gang crime reduction of 37% so far in 2018. And our violent crime, our Part 1 violent crime, our serious Part 1 violent crime is down right now by 4% citywide through 2018. And these are a combination of a lot of the programs, and what I've detailed for you here are the programs that are the focus of suppression and prevention. We have other programs, but this is what we work and basically employ within our areas, within the 21 areas on a citywide basis to address these crimes before they happen, to build these relationships for the long term, and then we are there to ensure that we provide suppression efforts to protect the community members if violence does erupt, and we are able to suppress it quickly.
Thank you.
Thank you.
You're welcome.
I have a quick question. This is a great program, by the way. Thank you for
You're welcome.
You said that there's 86 fewer crimes, 11 fewer homicides this year. How is that measured from, is it the kids coming forward with a counselor or someone saying, hey, I was going to kill this guy? Or how do you measure that number of decrease crime or homicides?
Well, the way we measure it is what we had at this time last year, so we can find out exactly what the number is and what the reduction efforts are. What I would have to do is go back into each individual case to find out, how they found out, how the warrants were served, how the intelligence was developed. Was it where the officers rolled out there and prevented a crime of violence? It happens in a number of ways, and that I don't have the specifics on. Just the outstanding numbers that we have: 86 fewer victims that were hit by gunfire this year.
Sure. So it's an overall number for with the hopes that a lot of this program is a reason why, but we can't separate the two at this time.
No, sir.
Okay.
I wouldn't even separate the two because they work, hand in foot with the department, and a lot of our serious violent crimes involve gang-related issues.
Okay.
If I can just jump in on that, though, what I'd say of that report I told you that the UCLA professor did,
Yes.
what he was able to do, sort of the comparison and control group in that was where there was only an LAPD response or there was an LAPD plus GRID response.
Okay.
And that's what he was comparing that's predictive analytics. I mean,
Sure.
that's the hard part about the work of, like, if an intervention worker or group of intervention workers have prevented a homicide, how do we prove that? Well, just like a lot of things, we're using big data and analytics. LAPD data matched incident by incident with our data response, our database, and look at the difference when only LAPD responds, and then when our model's in place. And that's when the analysis came up with the 185 fewer shootings or homicides over that 2-year period.
Other questions?
And I'd just add, I think one of the things, again, you're talking about what's different in other cities. Again, we make sure that, to Commander's point, like, obviously intervention workers, in order to be effective, they can't be seen, sitting around having a cup of coffee with officers and yucking it up with them. We act as that bridge and buffer. In some instances, intervention workers have developed relationships and might have a conversation, again, not about who did it, but how to respond or how to direct resources to a particular thing. But I will tell you, again, I don't think any other city has built enough trust that when LAPD has a system, an email system, when shootings or homicides happened, a electronic notification goes out, usually within a half hour, 20 minutes, of a shooting or a homicide, or it could be a traffic accident, an officer-involved shooting. Certain things. But for all those shootings and homicides, our intervention workers get those emails too for the area in which they work. Now, if you told somebody 15 years ago in the LAPD that they would be sharing their electronic information with folks that were former gang members, every last one of them would have told you that you were crazy. And yet, here we are because of what's been built. It's bare bones information, but it gets started. Now, obviously, if it's a gang shooting, most of our intervention workers have heard about the gang shooting before that notification, but not always. And then sometimes my team will get a call from the captain or a lieutenant. Sometimes they'll get a call from the intervention worker, or sometimes they're sitting in a meeting and that's the first thing they get. And that's what activates us all. But that's just unique to LA, that we have come so far in 10 or 11 years that kind of just electronic information sharing happens. And the sky didn't fall, right? Just like the fact that we fund intervention workers through public funds. 10 or 12 years ago, people would have said, no, you can't do it. What if you're paying that person, they're being paid through city funds, and they go out and kill someone? That's going to be horrible. Well, I'm very happy to say that has not happened. Some have been arrested on occasion for low-level offenses, but there's been no big scandal or tragedy because we've worked to professionalize and train them and make sure we have the right folks, the folks that really are ready to move on.
Just to add a quick point to Ms. Tremblay, I sit in a lot of high-level meetings with the chiefs, and all of the chiefs throughout the city of Los Angeles. The first thing they ask is, was GRID notified? And are you working with GRID? Have you engaged them in this crime incident, this shooting, this gang incident? And every chief, down to the number, which there are probably 10 or 11, say that every single day. All the way from the chief of police who asks them to the other chiefs who sit there and basically drive the bureau responses is, have you notified GRID, and are they involved?
What percentage of, on an annual basis, homicides and violent crime is related to gangs versus other population?
Estimate probably, I would say traditionally, probably about maybe high 30s, 30%, maybe 40%.
So obviously the efforts that you're both doing have a major impact in driving the total numbers down. Because if you lower it by 15, 20% in regards to gang, then we're dropping the total city by 6%, which is a big number.
Yes, sir.
Great, thank you.
Yes?
With the work that you're doing, the police, the summer night lights, and creating that relationship, do you see the kids that are in the prevention and intervention programs wanting to join the cadets, cadet program for the LAPD? Or?
We do. We pick up cadets from summer night lights programs. We pick up cadets from contacts and interactions that the officers have all the time. I mean, from community meetings to park meetings to summer night lights to national night out. We basically find that we get recruits from there all the time. It's been a very effective source for us.
That would be one indicator, a measure of the kids really wanting to transition, right?
Yes.
Do you have trends in the number of kids that are joining gangs? I'm assuming it's down a little bit, but do you actually have numbers or estimates?
I do not. You may.
I don't. I think it's really tough to measure. It's not like people get a membership card, right? I think because even just the estimates of what the numbers of gang members are in the city, they're just that. They're estimates. The number of gangs, the number of gang members. I think one of the things that we try to focus on, and this might sound crazy, but bear with me, right, is we're focused much less on that absolute of whether someone has some affinity to the gang or not. It's about the behavior, right? Because being a member of a street gang is not against the law, right? It's what you do. It's how you act. And I think in some communities, as you can imagine, There are people who feel a connection to a gang or a neighborhood associated with that game and may identify their neighborhood who aren't gang members. That's a cultural, historical fact in this city where there's that kind of identification. For example, in a housing development. So our focus, whether it's at Summer Night Lights or in these programs, is on behavior. And then with our model, it's if they have that strong gang tie, which can then, there can be some positive aspects to a strong gang tie. For some youth, if they're missing that connection and bonding with, say, within their own family. So that the model and the case managers are trying to work with that youth or young adult to find a positive adult role model, find that pro-social connection to replace whatever positive they might be, so they don't also take on the negative antisocial behavior of the gang. And so that's our focus rather than numbers, because I'm not sure, again, since it's all based on estimates, we'd ever know for sure.
Yeah. Any other questions? Thank you so much for your presentation. Just FYI, last week was National Public Health Week, and I don't think that many people realize that violence is a public health issue. So it was really part of the reason why I asked you all to come out this evening so that we could hear and understand some of the work that is happening in the city around these very important public health issues. So thank you very much.
Sure. And I'll just leave this folder. I have copies of both what I emailed you, Commission President, as well as the summary of the impact of GRID.
Thank you. Thank you so much.
Thank you for being here.
Thank you.
Yeah, thank you.
Moving on to item number 2, discussion and or action on focus areas and next steps for the Los Angeles City Health Commission. Oh.
Public comment.
Oh, that's right. I am so sorry. Do we have any public comment for item number 1? No. Okay. Thank you for reminding me. Okay. So back to item number 2. We need to have a discussion about or action on focus areas and next steps for the Los Angeles City Health Commission. So I think that I'll just start by saying over the last few months, at least from my perspective, really been concerned about what our next steps are, what our focus is. I know we have a very specific sort of list of priorities that were given to us, or duties, or things that were given to us when this commission was first created, but just really concerned about where we go from here. So I am open to hearing any thoughts and conversations. I had talked to Commissioner Sharp via email, and we talked about perhaps surveying the council members to ask their impressions. And just to say that I have talked to, we do have an intern. He was here the last meeting, I believe, and I can make sure he's here for the next one. And he has expressed interest in helping us get that done. So also just want to open that up to the commission. Any thoughts, questions, concerns, ideas on how we can move forward on our focus areas and next steps? Yes, Grimmy, sorry.
Yeah. So I think, from the standpoint, I've talked to my council member, and from the standpoint of why you mentioned that there's specific things we should be looking at. In my conversations, it was more presented as the council should kind of figure out what it wants to do, and maybe it being something different than what council members are looking at on a daily and monthly basis, or whether that's something they're looking at and they're missing something. I think the council needs to kind of find out what niche it fits into and then go after that instead of repeating efforts, because I don't think that's a good use of our time or their time. It's to bring, I think we need to be able to bring something to them that they're not looking at, to be able to get it on their plate and address, instead of addressing things that they're currently doing.
Sounds good.
The other thing I would say in regards to that is that we don't be redundant with what the county's doing too. So a lot of the planning and strategic aspects of public health are being addressed by the county. And so it would be redundant for us to look into things that the county's already spending time, money, and resources doing. We should try to be a little bit more creative.
Commissioner Kato?
Yeah, the first year, we spend a lot of time breaking up into the subgroups and making recommendations. And it just, you don't hear anything back. We did that work, and I think we have to get feedback. We're here for them. We give them recommendations. I think that's one important thing. And, somehow, within the greater plan for a healthy LA, see what progress is being made and see, what other areas that the commission, can be working on to help the council get a better idea to move things into gear.
Yeah, I think to your point, Commissioner Kato, I was thinking the same thing. We had created that document. Commissioner Shannon was president at the time, and I don't think we ever, at least I had never heard anything back from, oh, here's our report to the council. I didn't recall hearing anything back, and I could be wrong. Commissioner Shannon?
Okay, so actually we did get feedback. I know that Councilmember Bonin had written a letter to the entire Health Commission stating what he thought were some of the important points that we had brought up. I know that 3 different community organizations now have used that report to push on various issues, one of which was the use of Narcan for opioid use. And this was an organization that had absolutely no idea that we had done that. And I was able to talk to them and say, actually, you can use this Health Commission report. And I know that they've been going from council member to the various offices using that report. Also Vision Zero, which was extremely controversial, particularly in Councilmember Bonin's district recently. So I think that they're very grateful that we had given at least a bit of an analysis in terms of the Health Commission on that particular program, and then also for Housing for Health. So we did have a retreat. We did look at various issues that we wanted to focus on. My understanding was that we had disbanded our working groups, and instead we were going to work on all of these issues while we are in session here for the Health Commission, which I don't see that that's happened yet. So I would say that either we need to decide to work in working groups, or we need to actually, spend 3 or 4 hours here hashing out these issues and the actual language for the report. But we are mandated to do a report, and it's been a year and 3 months since we've had a report come out. So I do know that community organizations are using these reports. I do know now that the council members are using them, and I don't think they need to necessarily be medical journal articles. I know that there's debate over that, and whether or not people, particularly these community organizations, want it in sort of layman's terms or something more scientific. And that's going to be, I think, a debate that we're going to have in terms of the Health Commission, in terms of who's utilizing these documents. But I think we do need a way forward. And if we're not going to break out in groups, we have to have much longer meetings and really hash this out.
I think it's going to be data-driven. So if you have a report that's based on anecdotal evidence, then that's all it is. It's a document with anecdotal evidence that potentially people make decisions of public policy on that isn't necessarily going to be beneficial to the citizens of the city of Los Angeles. And so we have to get data. And if we don't have data, then it can actually cause more harm than good. I mean, as a physician, it's kind of a pledge that we make, first do no harm. And I think as public policy leaders, this commission has to understand that we need to have good data. If we don't have good data, then anything that we say, anything that is acted upon, could potentially be more harmful than good.
Yeah, I think it goes back to the question that I think we've had from the very beginning about the need for staff, or, in addition to what we have with Candy, but we need someone to do that work, to provide that data, to do that level of analysis, and I don't think that, and I'll speak for myself, I don't have the capacity to do that, and I don't know if anyone else does. So I think that's always sort of been the thorn, in the side of any of the work that we are trying to do here. Any other thoughts?
Yeah, I mean, we just listened to two wonderful presentations from very knowledgeable, very caring individuals that have massive budgets. I mean, the GRID program, if you just added it up, is $34.6 million through their 5 little divisions. And they estimate that there's a return on their investment on an annual basis of 3 to 1, approximately. I think that's wonderful. I think it's great. But they have, and I'm not asking for $36 million, for a budget. But if we don't have some budget, we're not going to have any data, because none of us have time to be full-time employees or volunteers for the city of Los Angeles. And we'd love to do it, but we have other responsibilities. So unless we have some staff that can do serious research, we're going to only have what's been fed to us that's questionable from a scientific or academic point of view. Potentially, any report based upon that is going to be pure either hearsay or anecdote, both of which are very harmful to make public policy.
Yeah, I agree with that. I think the one thing we need to do too is figure out what we need that money for. Like, if we, it's great that, hey, we need money, but here's what we want to do. Here's what we want to look at. Here's the data we want to gather, and this is why we need the money. Instead of making a general blanket statement, I think we need to figure out, like you said, there's a mandate, but what's our function? Like, what are we looking at? What are we doing? I think if we are a little bit more direct in what we want to look at, what we want to do, then that money and that data that we want to get, it's specific instead of being generalized. It's easier to get money when you're specific than just general ideas of what we want to do.
So would that potentially be a next step to hash that out, that ask, and
I think that's
ask?
the first step. Yeah.
Hash out the ask and then ask for the additional funding and see what happens?
On page 3 of the packet prepared by Ms. Clerk Rosales.
Afraid I can't hear you.
I was trying to talk close specifically for you, John. I will talk even louder, which is, by the way, why we requested our speakers to speak directly in the microphone, out of respect for you, Commissioner Hisrick. The minutes from the February 12th meeting reflect that agenda item number 2 was adopted to request funding in a particular dollar range for positions to support the work of the commission. So in response to the specific suggestion that there be an ask for money, that has been transpired at least as a motion at this commission level.
No, my point is, that's great. I know we did that, but we need to, I think it's better if we have a specific thing we're asking for, and just other than money, we just want money to go do stuff, instead of we want money to do these things.
So my recommendation would be to pick the focus areas. I think there's been, it's easy to mix and match requests for activity support, like data collection or preparation of a report, which are functions, with subject area requests. And I think the interest of this building is likely to be stronger if we identify like a subject area to study, whether that's the gaps in access to acute care beds, right, is a subject area, or chromium-6 poisoning, I think, chromium hexafluence. There's subject areas, and then there's functions
Sure.
to execute on those. And I think the underlying ordinance that describes this body mixes those up in a very confusing way that has made it difficult for someone to stare at it and figure out, what are we doing? Are we providing oversight of how the county does things? Are we auditing things? There's a number of different, are we preparing a report? There's a number of different functions described. And I think the greatest momentum will occur from identifying a few subject areas that are of some, political or community interest, and then trying to bring some resources to bear on those, whether it's data collection or community convening or some analytic function that leads to a report. That would be the order I would advise proceeding along. First the subjects, then second figuring out the functions or the tasks to deliver.
Yes.
So I will defer to the president of the commission here, but I would say if we could, for the next meeting, and I won't make this a motion, it's up to you if you want to agendize it, but if we can look at the subject areas that we outlined at the retreat, that's in our minutes, it's also an audio recording, and then for each of those specific areas, we can have a plan moving forward. I mean, I think there are universities, there are organizations, there are agencies who are collecting data all the time. I don't call that anecdotal. I think that that's real data, and I think how we provide that information in the report, whether that's in layman's terms or not, I think is important for our city council and important for community organizations that are actually utilizing these reports. And I think if we can at least have a way forward at our next meeting, just looking at each one of these issue areas, and even whether or not we think that if they're still priorities at this point, because that was about, I don't know, 4 or 5 months ago. I think that would be good. And then maybe, I don't know, I think the work group model might work out better than having really long meetings. I keep going back to that, but I'll defer to the president.
I have a question. Do we have is there a way to get a list of what the city and the county, like areas, specific areas they're looking at so we can find out where the holes are?
Say it again one more time.
So can we get a list of the specific areas that the city and the county are looking at from a health perspective so we can find out if there are certain holes where we can fit in, or instead of duplicating efforts?
Well, I know that the Public Health Department, there are some priority areas that they're working on: infant mortality, environmental justice issues. There are a couple of other things that the county is working on. Homelessness, and I think there's a couple others.
The county is looking at everything. I mean, the county is looking at population trends. They're looking at anything that you could define as public health. The county has a massive budget and a massive strategic planning organization that addresses health trends, population trends, and any disease that you could imagine, whether it be infectious disease, cardiovascular health, cancer, anything that is classic CDC type public health stuff is being done also at the county level. Separate from that is, what is the city doing? The city is very complex because for the history of the city going back to its founding, it didn't really have that function. Most cities don't. It's a county kind of existence. So our commission was created, and we don't really know, other than what the law says, what we're supposed to be doing. And the law has been written in a way that doesn't really give us direction. I can make an argument that maybe our first focus should be a strategic plan for this commission. I mean, it's not uncommon for organizations to say, what are you going to do? What is your strategic plan for your body? We're given a direction that is so broad that it can't be done. And what we know sometimes, unfortunately, it's just like any of us. If you came into my desk and had 83,000 documents on my desk, it's just overwhelming. It's hard to focus on anything. But if you can put things in order, then you can address them. And I think that's one of the problems we have. We've been given a task that truly is impossible for a volunteer organization with those staff other than city council part-time and city clerk part-time.
And I think the other difficulty, or even when I've been talking to folks, that have been on commissions for a number of years, when I talked to them about it, they're like, that's weird. The city doesn't have a health department. What department are you tied to? And usually the commissions are linked to a specific, public works. There's these very specific programs that are tied to the commission so that there is this, direct line. And we don't have that. And I think that's also the added layer of confusion. But to Commissioner Shannon's comment, I am interested in spending some time in that next meeting looking at what we came up with at the retreat, looking at it again, and hopefully using that as a way to move forward, or as an attempt to move forward. But I think ultimately, in my opinion, we may end up in the same spot. We're going to continue to end up in the same kind of this weird middle ground. Like, where are we? That's just my impression. So, Commissioner Shannon, are you planning? You want to make that motion?
I don't need to make it a motion. I think if you want to agendize it at the next meeting or whenever you feel it's, I mean, I've been in that position. And I know that when there's motions for an agenda and then something else comes up, it can get a little cumbersome sometimes, or sometimes it doesn't fit within the timeline. So I'll let you decide on when you want to do that.
Perfect.
Just to go back to the wonderful presentation that we had today, if you just look at the grid office has 15 staff members and 16 consultants. And they're successful. I'm not asking for 15 staff members and 16 consultants. But it'd be nice if we had one or two people that could really help us collect the information and data that we need to have so we can, make a report that really can be acted upon.
Yes. So, I mean, there's a difference between a commission and a department. And originally, AIDS Healthcare Foundation wanted there to be a public health department because they felt that the county was falling short in a lot of areas.
Right.
And the compromise between the city council and AHF was that instead there would be a public health commission, and that we would be deciding what those priorities are, and that we would be basically delineating those priorities to the council, providing an oral report, providing a written report in terms of what these priorities are. Maybe where the county is falling short. I mean, that does need to be one of the things. And then other things that we feel that the council can do to help and protect the public health and safety of people who live in Los Angeles. It's, I mean, maybe it may be helpful to just have Michael Weinstein come here and explain what the agreement was between him, or the understanding between him and the city when they were talking about this, because that was the agreement. And so we're not a department, we're not going to get $26 million necessarily, which is what a department would get, or a program like that. So
the budget of the counties of Los Angeles' health system is larger than the budget of 42 states of this great union. It is massive. It is truly remarkable. Anyone who would say that great institution, the LA County Department of Health Services, is falling short in any area is opening him or herself up to just a false statement that cannot be backed up with any data. Now, the politics of why the commission was created because of AIDS Healthcare Foundation or Michael Weinstein, who is a very dedicated, caring, and intelligent individual who cares about the city of Los Angeles, and we have to give him credit for the great things he and his organization have done. But he doesn't speak for the city of Los Angeles or for the commission or for the city council. The city council created this commission as a compromise with Mr. Weinstein to prevent one institution, AIDS Health Foundation, from putting a ballot measure on the ballot that would force funds to go to something that many people in the city leadership felt was redundant to what the County of Los Angeles is doing. So any of us as an individual have a right to advocate for something we care about, but it's a big difference to manipulate a governmental entity to do something that Howie wants, or Matt wants, or Nicole wants. And so we're finding ourselves in a situation that we've been given something that was a compromise between what was felt to be a need in the city, but not really given the resources to enable that compromise to go through. And until the city council either gives us those resources, or alternatively has a serious debate among themselves, the 15 members of the council and the mayor of Los Angeles, and say that maybe this was a mistake. Maybe this commission is not going to be functional, in which case we're wasting the time of currently 9 dedicated, caring individuals who care about healthcare in the city of Los Angeles, who are volunteers, and $100,000 of city budget because we're not very functional. But that's for the we serve at the pleasure of the council.
If you remember when we came into existence, it had to do with, we were supposed to have some oversight of the county's health functions in relation to the city. But it's sort of hard to figure out, we were supposed to go to all these meetings and see. It's hard pressed to determine that or to do that. I mean, in the city of LA, they put the A, B, and C on the restaurants. Okay, I'm not sure I'm going to, oversee that. And they operate the county health system, the hospitals. Okay, are we going to have something to do with that? I wasn't ever clear to me what county functions we were going to monitor or see if they were adequate. I know at the danger of harping on it, the one that I'm interested in is the only one that the city provides real health care through and does have a relationship with the county. I'd love to find other areas where a similar kind of interaction would be appropriate. I'm just not sure what it is. Tonight's presentation was very interesting. I have no idea what I'm supposed to do about it, other than to say, right on, and hope that the county sends park workers out there or whatever they need. But I'm sort of hard-pressed to know what the function is of the commission compared to what it was supposed to be when it was set up. We're sort of in lieu of a department.
Right.
There had been a county health department until 1964-65 when they absorbed it into the county.
Right.
And everybody said fine. And then, and why the AIDS Healthcare Foundation was so concerned that they felt the need to establish a city health department was never entirely clear to me as to what the beef was, so anyway.
Commissioner Shannon?
So I was just providing historical background for some of the commissioners who may not have been here when we first began meeting. And if there are areas where you don't think the county's falling short, you can take that up with Mr. Weinstein. I was just providing that for just basic background. I do know that what had sort of incited that was that there were a number of, particularly men in the LGBT community, who were dying of meningitis. And I think that AIDS Healthcare Foundation had felt that the county had not alerted people within that community quick enough, or in ways like at Pride festivals, stuff like that this was happening and that a number of people had died. And I think that was the sort of impetus for saying, hey, maybe we need a city public health department that will maybe react quicker, or maybe can get out into these circles much quicker than the county. And I think that was the original impetus for this. that led them to say, hey, if the county isn't going to do anything, maybe we should go back to having a public health department here in the city. And I think that's what started it.
Yeah.
But the County of Los Angeles actually has a whole division that its job is to educate and notify people of infectious disease. I mean, there's a whole division of the county. I mean, the County of Los Angeles public health budget, I believe, is $10.6 billion with a B. I think it would be a little bit hubris for any one individual to say that institution doesn't have the resources or capabilities of responding to any public health issue, and that recreating the wheel with a budget of $100,000 is going to at all have an impact where $10.6 billion doesn't. We have had the pleasure of having government affairs officers of AIDS Healthcare Foundation at our commission meetings since the beginning, including today. In fact, if there's one organization that has been here more than any other organization or has been here 100% or 99% of all our meetings, it's been a representative who's a paid employee of the AIDS Healthcare Foundation. Today there was presentations which were wonderful by members of our community who took time off to come down to our commission to testify on something that is a congressional act. It is something that a member of the House of Representatives is putting into the federal budget. The last time I looked at this wonderful, beautiful, historic chamber, this is a city of Los Angeles. It has nothing to do with the United States House of Representatives or the United States Senate, which is going to be acting on that bill. And so I welcome members of the community to come to testify to us and advocate for legislation. But the legislation they ought to be advocating for are laws or rules that are passed by the City Council and not the U.S. House of Representatives of the United States Senate.
Would it affect the constituents of the city, and that information can help the constituents of the city make a better decision of how they want to act at the federal level, right?
Sure, and the state of California has, correct me if I'm wrong, 54 members of the House of Representatives, of which I think there is 17 that are representing parts of the city of Los Angeles or county of Los Angeles, and that each of those representatives would be more than willing to have themselves and or their full-time health legislative assistants meet with people who have a concern about federal legislation. I mean, that's the place where the Constitution has been set up to be representative democracy. It's called the House of Representatives. That's the place you're supposed to go.
Commissioner Sharp?
Thank you, Madam Chair. I have discovered deep in my package the duties of the commission. I will summarize instead of reading them. Number 1, attend county meetings. Number 2, publish an annual health plan. Number 3, present to City Council. Number 4, review a sample of county contracts. There's a lot more words, but those are the 4 duties prescribed in the original ordinance. And I think my experience is, my observation, is that each of these functions is being done by one or another part of the city on behalf of city residents, perhaps not well, not effectively, etc., but they're being done. The city is well represented at county meetings that I'm at for professional purposes. The city has several different health plans separate from the apparatus that the county has put together, and some of it is just a timing challenge. This was adopted, and then subsequently the city adopted Plan for Healthy LA and adopted the Sustainability Plan, which is very much about neighborhood health. And I don't think the city has any authority to examine county contracts, but certainly the county auditor controller does, as do other arms of the state government that provide the funding. So I guess my request, President Vick, for the May meeting, if you prepare the agenda item, is to try and gather some input from, outside this body as to where we could add some value that is not duplicative.
Okay. Sounds good to me.
You know, if I might, there would be a notion that maybe we should invite more people from the county who carry out health functions to come and describe what they do in the city or something like that. I mean, just because city departments, they don't do, the tangential health stuff. If we had the county come and describe the restaurant inspection program or some other functions that they carry out, we might learn something and maybe convey information. I'm just looking for things to throw out as possibilities.
A problem with that, I think it's a wonderful idea. The problem with that is the county collects its data in little pods.
Right.
And those
They have
pods
units,
include
yeah.
numerous cities, and there isn't one just for the city of Los Angeles.
They have planning areas, but they do overlap jurisdictional boundaries.
Right. Which is just like the LAUSD that has a certain number of planning districts, but they have 5 members of their leadership that there's an overlap. So each individual member of LAUSD doesn't even have the ability to have data that is accurate for their own district that they're in charge of. It's ludicrous, but that's the system that the county health system is in, and it's also the system that the educational system of Los Angeles School District is in. It makes no sense, but it is what it is.
And maybe that's the ask. Maybe when we talk about gaps and we talk about things that are missing, maybe it is, to the extent that we don't have that much authority and power, but that recommendation is that we ask or want the health department and other Department of Health Services to provide information at the city level. And I do know that there are some subtleties and some issues with data and how you analyze it, and sometimes it's hard to do, but maybe that is something that can be a tangible ask. Hey, we would like to have that information at the city level, and it's not always done that way.
To what end?
Well, for one thing, it could help with planning, right? So if the information is always provided at the SPA level around STDs, around environmental justice issues, around infant mortality, around these other public health or healthcare related issues, and it's not broken down by city, then it'd be easier for people to make certain types of policy decisions, funding decisions, if that information is made available at the city level. So that's just a question of, having the information available so that it's easier to understand it.
I think the challenge is raising expectations that this particular body is going to be able to take steps with that,
Right.
given its current configuration and other professional commitments that folks have. The capacity to act on that information is limited.
Yep.
We made in this report various recommendations, and the recommendations goes to the city of LA, but a lot of it is run by the county. Okay. So, for example, sobering centers. The city of Los Angeles explores supporting the expansion of sobering centers throughout all areas of Los Angeles. This is a county endeavor, right? And so, well, maybe we could have people that in the county that work with these enlighten us on how we can start opening more of these up within the city of Los Angeles in different areas, or areas that they're targeting, share it with us, so we could start working with the council member of that district to see something like this. It was one of our recommendations. We could get information and see if we can follow through so that something gets realized. I feel happy if the recommendations that we're making, at least one of them gets realized in this term. Not just making recommendations that are going to, be on paper.
Commissioner Shannon?
So they did expand sobering centers, I mean, there was one in particular that the Housing for Health Department was looking at, sort of right next to their facility. And the city of Los Angeles does need to play a part in that, whether it's permitting or providing space for that, or sending a message to the county supervisors as a city council that we think this is an important thing to do. They work hand in hand. No entity is of itself. If the city council actually passes something, which we have many, many times in the city, that says we would like our congressional representatives who serve the city of Los Angeles as part of their district to put in some legislation to help us, that happens all the time. We have city council members going to Washington, D.C. all the time.
Oh, okay,
All of these entities work together. So if the city says, you know, we think this would be a benefit to our residents, and we agree maybe with this county agency that's having trouble, you know, getting the county to prioritize this, that happens. These don't work in, government doesn't work in little bubbles like that.
Right, but if there's
Everyone is putting political pressure on other entities to help their district.
But, you know, there's got to be collaboration with the efforts, because I know in Council District 11, Kuhl's office tried to put one in, and when the news got out, because there was no outreach, the neighborhood council, everybody went against it. They had to pull back. They were already in the process of pulling the permits. So it didn't work. I mean, a great idea, but it's got to, you know, they have to reach out to the city. None of the field depths where the submarine center was going to be placed knew about it until the very end. And so, I mean, you know, these issues, I think we could help. And, you know, submarine centers on the west side isn't something easy to place, because most of the constituents there don't want it. But it's a necessary service.
But don't you think if a health commission is saying that we think that this is important, and making that case in our report, and making that case to community members, if we're asked to speak there, is an important part of that?
Yeah, but I think the county people have to hear what we're saying.
Exactly.
And I also think along with that, we need to have some authority. I mean, just to say, I don't know.
I love the concept of a sobering center. I don't know if it's necessary in the west side of Los Angeles. You know, we have 15 city council districts. I can't say that what's good for the goose is good for the gander. I mean, there's some things that are important for one area that might not be important for the other area. It would be hubris for me to say I know better than what the people in Councilman Bonin's district and or the people of the neighborhood council, they know their community better. I mean, our country was founded on liberties of local communities who have elected representatives. The city council members and their departments and their districts are the representatives. The neighborhood councils are the local representatives. For us to tell that, hey, listen, this is a great idea, it might be. I don't know that it's necessarily the best idea for every one of the 15 city councils districts. Some things are. There's more homelessness in some areas than there are in other areas. There's more need of some things than in other areas.
So this is one of the things that the councilman wanted, but because the city didn't really work, the county didn't work the liaison with it and work with the neighborhood councils and outreach, it blew up.
Exactly.
Unfortunately to the council.
And that's a problem for us too. That for us to, it's not top down. It has to be inherent in the local community. We can give recommendations, but the recommendations that we can give or should give have to be based on scientific data. If we don't have the data, we can't make recommendations that are global for the city of Los Angeles. This is a very diverse city in regards to not necessarily racial or economic, but in regards to healthcare as well. It's not one area, the big city of Los Angeles, everything's the same. Things are a little bit different in regards to public health in one area than another. And without the data, you can't make recommendations. A perfect example would be maternal mortality. Is it a big problem in the city of Los Angeles? Some parts it is, but in other parts it's not.
Were you going to say something, Commissioner Sharp?
Look
forward to your guidance in the May meeting and further
Yes.
addressing and refining the focus of this body.
Thank you. Any other comments? I'm going to take all of this back and go into my quiet place and ponder. Um, And and I'll probably be reaching out to each of you just to get some more feedback, but thank you for that. Let's move on to item number 3, discussion and or, oh, is there a public comment for item number 2? I know, no, you're right, thank you. It's because I don't see anybody, yeah, but you're right. Item number 3, discussion and or action on Los Angeles City Health Commission vacancies. So we have quite a few vacancies. Candy did a good job of sending me the attendance roster for, I think, the last several months. I have been talking to the intern who some of you didn't meet, but I'll make sure he comes back, trying to get everything clear about who's missing, what spots need to be filled. But if you know people that would be interested in serving, please let us know. Is there any other discussion around the commission vacancies? I think part of the issue, of course, is related to item number 2. We don't really know what we're doing. How can we sell the seats?
I have a question. Does the vacancy to be filled, does that person have to be affiliated with that council district?
From what I recall, the conversation, the answer to that was
I don't
no.
live in the district that I represent.
They just have to be nominated or appointed by a council member.
That
I
council member
represent,
where the vacancy is.
I represent Paul Corrett's district. I don't live in Paul Corrett's district. I have an office in Paul Corrett's district, but theoretically, it doesn't have to be that way.
Commissioner Shannon?
Anyone who lives in the city of Los Angeles can be appointed by any council member.
I had a conversation with Councilman Rue last Wednesday and specifically discussed this, and he said he'd be more than willing to advocate on behalf of any of us that sent him qualified individuals to the 5, potentially 6 now openings. Did we have
Right.
another resignation, I believe?
Yeah, Ariola.
There's 5 vacancies.
There's 5 vacancies?
Is it more than 5? Okay.
5, okay, so we have 5 vacancies. And so Councilman Rue is the head of the subcommittee, Health Committee, I guess, right?
Yes.
He said that he'd be more than willing to carry the resume or curriculum vitae of any qualified individual that any of us know to the 5 city council members who currently do not have somebody representing their district.
Perfect. Commissioner Sharp?
I discussed the vacancy problem with a president of another city commission to ask for a little bit of guidance regarding what is working well. This is the only commission with such a significant portion of the slots not filled and low attendances to my knowledge. And I was told, and asked Brock for clarification, that the city charter includes a small per diem for the stabling of one's horse at City Hall. Upon the formation of the city's guiding documents 150 years ago, there was apparently a provision to provide a small sum to commissioners for the stabling of their horse when they were at City Hall. So it is a authentic question on my part as to whether there is some form of per diem that may be dangled in the front of commissioners who or potential appointees that would be asked to spend their evenings as part of this session. Does that provision have any ongoing merit or function in 2018? Sorry to pull you into this, Brock,
I'll
but
respond, but I would love to say, I don't know, considering if, I mean, obviously, I don't see any places to, tie up your horse around City Hall, although there
free
may
parking.
be locations I'm unaware of. However, I don't know if there is still that per diem component for commissioners. I will certainly look into that for you and report back to the president as soon as I find out whatever, if there are information out there.
with the modern day horse being an automobile or a bicycle, we do get free parking, so.
I know that. Still hoping there's an incentive somewhere out there.
I will look into the per diem issue for you, Mr. Sharp, and report back.
Fabulous. So again, we have 5 vacancies. If you know folks, please have them submit their resume, curriculum, CVs, any documentation, and we can get that to Councilmember Rue. Yeah. Any comments on item number?
If I can ask the city clerk, you've sent out the couple resumes that have come your way to the 5 members that currently have openings, and they haven't responded at all?
No, what I've done is I've told the people to go ahead and contact the council members directly, so they can go ahead and talk to them directly, let them know that they're available.
Gotcha. Okay. Well, being that the Councilman Ryu has said that he would help us, then I would say that any resumes or curriculum vitae ought to come to President Vick as our president, and if she feels it's appropriate, with consultation with some of us, we can create a subcommittee, membership committee, if you'd like, or just so that we're in compliance with the Brown Act, that we're not all meeting together, and she doesn't send the email to all of us, but less than half, that we can take turns looking at those resumes, that we can then send them to Councilman Rue's direction, and hopefully he can help us.
Perfect. I think that's a perfect idea. So yes, please send them to me. And I would even, I don't know, is this against the rules to actively recruit? But, to seek out people that you know that are doing that great work and ask them to please submit their information to me so that we can take a look. So I think that's one of the challenges, to get the commission fully staffed or attended. Any comments, public comment on item number 3?
Nope.
Okay.
Move to adjourn.
Second.
All right. Do we need to vote? No? I always ask that question. Okay, well, it looks like we have all ayes, no opposition, no abstentions. Thank you all. Okay.